With the kind of epidemiological curve that we are seeing right now in terms of the number of cases, given the caveat that we have no idea how many cases we've got because of the testing, but with the increase that we're seeing nonetheless, if we are heading toward very large numbers of Americans being infected with this virus, and as Dr. Fauci has said publicly, we're looking at a 15 to 20% serious illness rate among those who get infected. Should we expect that American hospitals are going to get crushed by a flood of very sick people?
Well, Rachel, we should expect that. And frankly, not even if we get anywhere near the numbers you were talking about in the last segment. We only have 1 million hospital beds in this country. 700,000 of them are full with people who are sick right now.
How many hospital beds do we have?
1 million.
1 million.
1 million. Now, of course, people come in and out of them. So over a course of a year, we hospitalize about 35 million people in the country. But as you said in the last segment also, Rachel, people who are hospitalized with this, if you're serious enough to go to the hospital with this, you're going to be there for a while, right? This isn't a 2-day hospitalization thing. And the problem is this, if you get a crush of cases in a particular city, a city like New York, but they could be big cities. We're not just talking about small cities where capacity is limited. We have limited numbers of ventilators. We have 65,000 ventilators for the whole country. Almost all of them are at use right now, particularly during flu season. If this really kicks up and creates just even a small increase, we're going to see hospitals in this country, in particular places, overwhelmed. And scenes like we're seeing in Italy right now of people in the hallways, people just not being able to get care. You find in these epidemics around the world that almost as many people often die not from the epidemic, but from the inability to get health care for other things. People get a chest pain. They don't go to the hospital because the line is too long or because they're afraid of getting the virus when they go to the hospital. And coronary incidences go up. So this is going to have effects on our healthcare system that go beyond even the dramatic effects of the virus itself.
Is it predictable where that's going to happen? Or does the pandemic terminology not just mean that it's internationally everywhere, but we should expect it to be everywhere domestically as well?
I think we should expect it to probably be everywhere, but not at the same time.
Okay.
And I think that's, again, one of the problems with this testing thing. What you want is intelligence of where it is and where it's going. And if you don't have measures, if you look at a map right now, that Johns Hopkins website, the best map, you see that there are states with many cases and states with 0 cases. There aren't states with 0 cases. There are states with 0 tests.
Yeah.
And so we don't really know where it is. We're fighting an enemy and we don't even know where it is.
What should the government do to surge capacity in American hospitals and prep for that now before we see it start to happen? We've all seen these testimonials from Italian doctors, right, talking about the Lombardy region and knowing that it was going to happen because there was a large center of infection in that region. And the doctors were prepared for it. They knew it was coming. They still couldn't do anything to manage the capacity, to manage the ultimate numbers that turned up. We're in the position now where we know that's about to happen. It hasn't started yet. That feels like gold in terms of that time. But can we do anything with this time to make sure we can handle it when it happens?
Well, I think we could. One thing I'd put a star on is I think we ought to watch for what's going to be a pivot, I predict, in the Trump administration rhetoric. I think increasingly they're going to say, hey, this is a state and local problem. We're here to provide technical expertise, but solving this will be up to governors and up to mayors. I think they're going to try to push this problem downward. The federal government does have tools, right? We have FEMA that we could use. They're really good at building things quickly after hurricanes and earthquakes. They might be able to be deployed to build temporary hospitals in cities and places that need them. Governors could use the National Guard.
Yeah, I'm imagining MASH units, hospital tents literally set up.
Exactly. And that's, again, what we do when there's a horrible hurricane or horrible tornado that kind of wipes out a medical facility. FEMA can sometimes do that. We need to be really creative about how this can happen. You see what's going on in Korea. It's not just the extreme care. It's things like testing, drive-through testing, trying to get the testing out of the healthcare center, protect the personnel, protect you when you're being tested from being infected by others. We just need to get more creative. We're not really seeing that from the White House. What we're seeing is kind of vague statements and vague direction, but not that kind of push to action.